Before we get started, I'd like to share with you a little bit about She Votes Illinois. She Votes Illinois is a statewide political action committee aimed at highlighting the importance of women's voices in elections, government, and policymaking, which brings us here tonight, policy. Our work focuses on three things: voting, education, and getting more women involved in the political process. As a note, She Votes Illinois supports expanding access to quality and culturally relevant maternal health services. The purpose of this event is a panel discussion for improving Black maternal health outcomes through legislation. And as far as the format for tonight, we'll have about 30 minutes for a panel discussion that will be followed by Q&A, and we'll close with calls to action. Let's start off with a brief overview of what's happening and why we're all here tonight. Pregnancy-related complications kill more mothers in the US than any other developed country, and Black birthing people die at 3 to 4 times the rate of white birthing people. Black people and birthing folks in the United States experience unacceptably poor maternal health outcomes, including disproportionately high rates of death related to pregnancy or childbirth. Black women younger than 30 are 2 to 3 times more likely to die from pregnancy-related causes than white women. Black birthing parents in Illinois are 3 to 6 times more likely to experience maternal mortality and morbidity. 72% of these pregnancy-related deaths were preventable. People with Medicaid coverage are 3 times more likely to experience maternal mortality and morbidity. Medicaid pays for 2 out of 3, 66% live births to Black parents in Cook County and Illinois. A large percentage of severe morbidity and maternal mortality occur 43 plus days after giving birth. There's plenty of misconceptions around Black maternal health. Kiara Bridges said in the NYU Law Review last year that there's strong evidence against the claim that disproportionate rates of chronic conditions among Black women fully explain racial disparities in maternal mortality. Many studies have documented that even if one controls for the increased prevalence of pre-existing conditions among Black women still have a greater chance of dying from a pregnancy complication than their white counterparts. We ought to interrogate why these narratives that Black women are dying because they're unhealthy has been as believable as it has been to so many observers. So, in other words, disparities exist across income and education levels, and it is widespread. Think back to Serena Williams, who nearly died after her hospital ignored her medical history. This is a recurring issue, so think through it. Doctors were so willing to disregard an internationally famous, wealthy woman. So what's going on with regular people behind those closed doors? Racism and bias in healthcare leads to mistrust, misdiagnosis, and severe complications for birthing parents, and some are turning to home birth, out of hospital setting, especially with COVID-19 playing a role. There's legislation that state has been looking at regarding the use of doulas and midwives that we'll touch on during the panel. Several of the facts I just stated are findings from the Illinois Task Force on Infant and Maternal Mortality among African Americans. Illinois has been looking to study the high death rates, figure out ways to force hospitals to collect more accurate data, be better equipped to treat pregnant people, and to mandate proper training for medical staff. The task force is gathering data that the legislators here this evening are going to put to effective use in the state and get some accountability on the issue. Now, to kick off our evening, let's introduce our panelists, legislators who have been spearheading solutions to the health disparities and racial health systems that perpetuates the Black maternal health crisis in Illinois. All of our panelists are currently members of the Illinois Legislative Black Caucus. I'd first like to introduce Illinois State Representative and Deputy Majority Leader of the 31st District, Mary Flowers. Mary Flowers is a Democratic member of the Illinois House of Representatives and serves as the House Deputy Majority Leader. She represented the 31st District from 1985 to 1993, the 21st District for the decade after that, and the 31st District again since 2003. On January 14th of this year, Representative Flowers became the longest serving African American legislator in Illinois' history. Her primary legislative focus has been on health and child welfare matters. She has been the principal sponsor of many essential healthcare legislations and welfare, education, and juvenile justice reforms. Over the course of 18 Illinois General Assemblies, Representative Flowers has served on 50 different committees, covering an extraordinary range of topics and issues in the House. Our next panelist is Illinois State Senator and Majority Caucus Chair of the 3rd District, Maddie Hunter. A native Chicagoan and former grassroots community organizer, State Senator Maddie Hunter has served in Illinois General Assembly since 2003. Senator Hunter serves in leadership as the Majority Caucus Chair and is the Vice Chair of the Ethics and Executive Appointments Committees. Senator Hunter's priorities remain focused on protecting schools, increasing public safety, creating economic opportunities, and expanding access to healthcare and fighting for equality. And our final panelist of the night, Illinois State Representative of the 78th District, Camille Lilly. Representative Camille Lilly was born and raised in the 78th Illinois House District and has spent her career advocating for and working toward economic opportunity, community development, health and wellness, and educational advancement for district residents. During her past role as a director of the West Garfield Park Families with a Future Program for Beth and New Life Incorporated, a nonprofit dedicated to sustainable development and challenged communities, Representative Lilly managed the state of Illinois' infant mortality initiative. The program led to a reduction on the infant mortality rate from 21 deaths per 1,000 live births to 17. We're so glad to be able to hear from these experienced legislators, so let's get right into it. For these questions, I'd like to hear from each of our phenomenal panelists. I'd first like to ask our panelists, what to you are the key aspects of the Black maternal health crisis that you discuss when talking to fellow constituents or legislators about the issue? As in, what's the top thing you wish more people knew about or thought about Black maternal health? And I'd like to start off with Representative Flowers.
Well, thank you very much. I appreciate you, and thank you very much for inviting me here tonight. Maybe about 4 or 5 years ago, I can't even, maybe 3 years ago, I can't remember. I had a hearing from doctors all around the state as well as outside the state on maternal mortality and infant mortality and morbidity. And I was really shocked to hear what their problems were, because you have to ask, what is the problem? What is it about Black women? Why is it that our babies are dying? Why is it that we're dying? And it really boiled down to something, I hate to say it's really simple, but it's really rather simple. It was all about racism. It's all about lack of knowledge. Some doctors no longer take their Hippocratic oath to do no harm. Nurses no longer take their Nightingale oath. And the teaching, there was this doctor, Dr. Sims, back in the 1800s. He experimented on African-American women. And later on in life, he was asked, well, didn't that hurt those women? He says, no, had it hurt them, I would have stopped. So because of Dr. Sims, the rumor, the lie is that Black women could stand more pain. And that's not true. I'm very happy to report that they did remove the statue of Dr. Sims in New York. But the fact of the matter is that so many women have died, have been mistreated because of lack of information and lack of knowledge. And until such time that we have a real discussion about race and the systemic problems that this country has been facing for a long time in regards to race. There was an article not too long ago in the newspaper about Black infants. You have to ask yourself the question, why is it that Black infants is dying at a higher rate in the hands of white doctors? What in the heck is going on? But of course, our community plays a large part. Lack of access to healthcare. And the policies that we've been implementing here in Springfield throughout my entire career has been really obnoxious. And you could see where the problem has lied. When you look at what happened just with the SMART Act, the SMART Act really gutted healthcare for poor people. Poor people didn't have the access to go to see their doctors, to have checkups. When you think about women of childbearing age. I've been introducing legislation for the longest that all women of childbearing age should have access to quality care. So when they do become pregnant, at least the doctors will have a history of them. But so many women present themselves in the emergency room of a hospital to deliver their babies, and the doctor has no knowledge of their medical background. The nurses and doctors don't get a chance to talk to the women about obesity, high blood pressure, a diet, exercise, and different things like that. So there's a multitude of problems, but one mainly is racism. Two is lack of health care. We do not have a healthcare system in the state of Illinois, nor in the United States of America. What we have is a sick system. And the only time that you can really get that care is when you become sick. That's not a way to spend our monies. That's not a way to prepare young people for the future to live a better quality of life. And we don't have to spend our money on healthcare because people will be well because we are investing into their care now. So I can go on and on, but for the sake of time, but I'll be here if you have any more questions. Thank you.
Thank you so much. Would any of our other panelists like to speak on this question?
Sure, I would. I'd like to thank you very much, She Votes, for inviting me to join you guys here today. You all are doing an awesome job and keep up the good work. I think it's always necessary to remind people that this conversation is about equal access to healthcare, as well as preventing death. Pregnancy in general is more dangerous than most people realize. It always has been, and the outcomes have generally gotten better as medical technology improved. However, the impact of systemic racism puts Black women in particular at a greater risk for dying of childbirth. And so we must continue to work on preventing maternal mortality, because too often these deaths are just totally preventable. I agree with everything that Leader Flowers stated. So it doesn't make any sense for me to repeat everything that she indicated. So I'm going to stop there to see if Rep. Lilly has anything else to add. Thank you very much.
Thank you, Leader Hunter and Leader Flowers. And yes, thank you for inviting us to be a part of the panel and talking with many of you who've been in this field for decades, trying to make sure that everyone has access to health care. The only thing that I could add in summation is one, as Leader Flower mentioned, the basic essential of life have been ignored in communities of African Americans for decades. Just no housing, no education, no food, no transportation, no healthcare, no jobs. Leader Flowers is absolutely correct that has been the root of the problem. But when you really talk about access, that's where we fail as a state to make sure that everyone has access, because healthcare is a right and it instills the quality of life in our citizens and in our communities and in our families' lives, in our women who are giving birth to their children. We failed to understand that the infant mortality initiative that we did back in the 80s had a tool that we stopped funding, which was the case management arm of making sure women had information and access through case managers. We call them neighbors, we can call them community health workers. They all have different names that help people navigate resources that's going to help them have a healthy child. It is truly missing in our healthcare model. We used to do it, but for whatever reason, funding changed, and we now have the backlash of the absence of those resources where we have Black maternal deaths for the children and the mother. So I'm just going to stop there, indicating that collectively, Leader Flowers, Leader Hunter have basically spelled out the opportunities that's before us.
Thank you so much, Representative Lilly. Thank you for talking about tools that are effective for this crisis. That leads me into my next question. Task forces are a tool for legislators to get legislative initiatives going, as we all know. Are you all finding the data coming out of the task force useful? How is the data collection important in regards to maternal health? And how is it aiding the development of legislation?
You're on mute, Leader Flowers. There you go.
Thank you. You're talking about House Bill 1. And I purposely made the task force House Bill 1 last session, because to me, that should have been the #1 issue that people across this state and across this country would be talking about. What is going on? And the only way we could find out is to create this task force to dig deep, to find out, why is it sexism? Why is it racism? Why is it misogyny? Why is it that so many Black women are dying? What is the problem? It didn't matter about the education, as Sherry J said, in regards to Serena Williams and Beyonce. These are wealthy women. They should have had the best of all services. But if they did not have the knowledge of their own bodies, they wouldn't be here today. So the fact of the matter is, this task force is to dig deep. And quite frankly, I didn't get a response. As a matter of fact, I wrote the Department of Public Health, I wrote Dr. Ezike a letter and told her what she sent out was not what I asked for in this task force. I wanted her to go around the country. I wanted her to go around the world to find out, what are other people doing to prevent this catastrophe that's going on in this country and in this state. I didn't get that answer. I didn't get an answer as to what are we going to do in the future to correct this problem. I didn't get an answer in regards to education. I didn't get an answer in regards to the delivery process and what's going on in the hospitals. Why is it that the committee that deals with maternal mortality in the Department of Public Health is not funded? Why is it that the birth certificates don't necessarily give the cause of death? According to the committee that's in the Department of Public Health, if they had more money, they could do a better investigation as to the reason of the death. And so oftentimes there's misinformation on the death certificate. That's the reason why I did the hospital reporting, because I wanted more information as to the reason why. Not being able to have prescription drugs. Also, at that hearing that I had, the doctors testified that they were always told to ignore Black women. When Black women come in complaining about various things, they say, you don't know what you're talking about. Or they'll just think we're on drugs, or we're crazy. I'm sure some of you remember the doctor that died last year sometimes, and she was a doctor. And she was trying to tell these doctors that was supposed to be waiting on her about what her concerns were. She was ignored. She was dismissed. She was one of them. She was a doctor, and she died as a result of it. So the task force, the information that I got from the task force, as a matter of fact, I would suggest that everyone look at the information, go online and look at the task force. And the first part of what they put out, And the reason why I really don't like to talk about numbers, and I don't know if you can see this or not, but this is, I thought it was rather cartoonish because that's exactly how they feel about Black women. We're some checks in a box. We don't have faces or names, and we're just a bunch of numbers. I didn't know. I didn't appreciate it, this response. And then there was another report that was put out, I guess, a couple months later. And I understood because of COVID that they could not get the report out in time. But the fact of the matter is, it wasn't thorough enough. It wasn't efficient enough. It didn't give us a blueprint. Where do we go? How are we going to intervene? What are we doing to prevent these women death? What are we doing in the hospital? There's another report out that talked about the nurses. And this was a report that was done by NPR. So please do not quote me as saying this, but this was a report that was done by NPR. And they questioned the nurses, and some of the nurses really didn't know what they should know. The reason why so many women were dying from high blood pressure, or some of them didn't have the right blood pressure cuff. A lot of the nurses really wasn't trained properly. So what's going on in the schools? What's going on in the institutions? Those are the places where we have to start. And again, systemic racism and funding. Why is it that my zip code has to dictate my quality of life? Why is it that my zip code has to dictate whether or not I'll be able to get medicine? And the hospitals that we have to go to. All hospitals are not one size fit all. Hospitals are different levels. Each hospital serves a certain purpose for a different group of people. But an ambulance is taking a mother to that particular hospital doesn't know that this hospital doesn't have the tools that it needs to deliver a baby, a high risk mother. And so the hospitals need to be numbered. They need the ambulance workers need to know about it. There's a lot of things that needs to be done as far as education and exposure in regards to what's going on in our healthcare system. But once again, to talk about the report that the Department of Public, the two reports that the Department of Public Health put out, I did not appreciate them. And I did write the director with all due respect, because I know she's been very busy with COVID. But maybe if we should be able to walk and chew gum at the same time. And so many people have died because of COVID, number one. But still, there's a high, it's worse now than it was a couple years ago. There's more women that's dying. And the saddest part about it, we'll never know how many, because the numbers, we haven't seen the numbers. I don't know what the numbers are. I don't know how many infants died. I don't know how many mothers died. I don't know. I just don't know. So no, I did not appreciate neither one of the reports, and it's not good enough. And the state of Illinois can do better, and the people of the state of Illinois deserve better, especially African-American women. There is no reason at all for Black women to be dying and treated. There is no different what's going on now than back in slavery time. Babies and women died in slavery, and here it is 2021, and we're still dying. There's a problem here, and it needs to be addressed. And I find it interesting that when you look at the front, these are not headlines in the newspapers. No one is upset about the babies, the Black babies dying. No one is upset and outraged about Black women dying. Something as natural as giving birth. I hope I answered your question. Thank you.
Oh, thank you so much, Representative Flowers. You definitely answered my question. You touched on an important misconception that just based on zip code. We have doctors, Black doctors dying, we have celebrities who have complications. So I want everyone to touch on this question because it's very important to debunk this misconception. higher education levels and higher socioeconomic status for Black women do not affect maternal health outcomes. Why? Why is that?
Well, in my opinion, there really is no good answer for this other than racism. You know, I mean, everything is racism as far as I'm concerned. You know, everyone deserves the same treatment and the same access to safe delivery. And it doesn't matter what their background is or what their financial situation is, you know, or the color of their skin. The fact that even Serena Williams of the world can still fall victim to statistics show how deep the institutionalized racism is and how much of a disregard they give to our lives. You know, I remember about 2 years ago, no, probably about 3 years ago, I believe it was pre COVID. There was a professional Black woman, well, she and her husband were both professionals, and she almost died during having birth while she was in the hospital. And so we came back and put some legislation in to take a look at what's going on here in Illinois and to prevent some of the same situations from occurring. And some of our Republican colleagues argued us down and said we were lying, that it didn't exist. The healthcare system is not set up like that. And they've never, ever heard of any situations like that. And we said we just jumped all over him and the other Republicans that joined him, because we said, how dare you? Now, you all don't have any problems in your community, but when it comes to the South and West Side and East St. Louis and other Black communities, it occurs on a regular basis. It's total neglect. They have no regard for a Black woman or a Black person's health, you know? And so this is something that we got to deal with, you know? So yeah, they need to be educated. White folks need to be educated on how to treat Black folks, period. Just period, you know, because too many of us are dying. We're losing our lives. And it's just totally unnecessary and it's unacceptable. Thank you.
The only thing that I would add in addressing this systematic racism that has been clearly outlined by the leaders here is maybe the solution. And it all stems from biases that exist in our society. And in the legislation that we put forth with a lot of the vision of Senator for Lyford, as well as Leader Flowers and Leader Hunter, is how we train our society and our professional about these biases that exist in our society. It is so key that we acknowledge that they are biases, which turn into the ugly face of racism. But it does require some education and some consciousness in addressing it. The other piece that, as we did our subject matter hearings, and what kept coming up from the experts is that there's a correlation between education and better health outcomes. But and it is natural when you are educated, but when you have those biases and those racist tendencies, it does impact the outcomes of people of color and Black women in particular. So we have to put all of that training, those biases in place as far as the training is concerned, so that we can begin to change the mindset of so many of our professionals who care for people.
If I may, I just want to elaborate that we also passed legislation a couple years back about the pregnancy in the workplace. And so many women had to hide their pregnancy because if their bosses knew that they were pregnant, they would lose their job, or either they were fired, or because they were pregnant, they still had to pick up those heavy boxes and just treat it awfully. And it was so amazing. This one particular place that I was told about, this guy, he hurt his leg over the weekend playing basketball, and he was able to sit down and rest his leg up, and his colleagues around him was able to help him. But the pregnant woman, she couldn't get a break. She couldn't get a bathroom break. She couldn't get a water break. She couldn't sit down. So those, even something as simple as that. And so we were very fortunate that we passed that bill. But that doesn't mean anything if the policies are not being implemented. We could pass all the laws that we want, but if the people on the other end, in the hospitals, in the labor and delivery room, in the school of nursing, if these people still don't see us as human beings, why is it that all women that's on Medicaid that might be pregnant, why is it that they don't have a doula? Why is it doulas are more important now than ever before? I don't understand that. Why is it that some of the husbands are being told that they can't go into the labor and delivery room with their significant others? Why is that when a woman would need someone to be there with them to get them through this trauma, to get them through this stress? Why is it that even Hispanic women, they need an interpreter? Why is it that they have been denied the opportunity to have someone in the labor and delivery room with them? We do not, and I have to make this clear, we do not have a healthcare system. There is no uniformity across this state and across this country. It depends on who you are that you might be able to get those services. But doulas are the law here in Illinois, but you would know it for some of the poor women on the South and West side. Having a midwife, a nurse midwife, is the law, but I've been introducing midwifery for years. If the hospitals don't want to take care of us, and if you look at the numbers of the women who may have died at home, I've never really heard or seen any statistics on how many women and infants may have been lost at the hands of midwives. But I do know the statistics of how many women and infants have been lost and hurt and died in the hospitals. Think about the emergency room people. I'm sorry, think about police officers. Think about strangers on the street that help women who's going into labor. Those babies don't die. They weren't born in the hospital, they were born on the streets. I've never heard of any of them. Now, I'm sure it may have happened, but I haven't heard about it as often as I've heard and read about the deaths in the hospital. What is going on in the hospitals that we need to have a discussion about? And because you have the newest equipment and the brightest lights and the biggest, tallest building, doesn't mean that we're getting the best care. So until such time that we allow women and healthcare providers to be able to talk to women about their about the services that's medically needed. Breastfeeding is something that's very important to a baby's life. But if you're rushing a person out of a hospital, or if you're a nurse and you don't know the proper etiquette of teaching a person how to breastfeed, if those things are not taught, all of that has a detrimental effect on our community.
Thank you so much. I know, Senator Hunter, you spoke about speaking to Republican legislators about this issue. Now I'm wondering, there's no shortage of critical issues and legislative work going on. How are you all having conversations with your fellow legislators to prioritize Black maternal health issues? And how do you get them to truly understand the severity of this crisis? I know you all have been doing some powerful work, but I just want to understand how are you getting them to get on our side and pass these important, crucial legislation?
Yes, thank you very much for that question. Black maternal health issues has been on my radar for a very long time. And in addition to that, last year, there have been a couple of initiatives that I've worked on to address this issue, including not only myself, but Rep. Lilly as well, regarding House Bill 158. And so we have monies in there. Well, the healthcare omnibus is what it was. And that included provisions dealing with maternal health, among other things. But this particular measure clarified the safety net hospital grant program. It created rather a safety net grant program for $50 million, but which is subject to appropriation. And it basically preserves or enhances the OB/GYN services of other specialty services at the hospital level. You know, it allowed us an opportunity also that where it required the Department of Human Services to update the Child Care Assistance Program eligibility calculator to include a question on whether a family is applying for child assistance for the first time or for redetermination. And lastly, it requires prenatal doula services, as you've heard earlier, and evidence-based home visiting program services to be covered under Medicaid. Now, as for our colleagues, we've had so many amendments to that piece of legislation to the point where we were finally able to get our colleagues to finally pay attention to what we were talking about in terms of Black maternal health. You know, making them aware of what's really going on out there, forcing them to the table, literally forcing them to the table to help address this need, you know. And that is basically what we had to do, was to get all in their face. I know that we had a leadership and a caucus meeting right after the unrest and the George Floyd situation, you know, where everybody was on pins and needles, including our community. And I was so furious and I was so angry that I just took over the leadership meeting. You know, the president had an agenda, and I just took it over and I said, wait. We cannot talk about no agenda for the upcoming session. We got to deal with what's going on out here in the streets today, you know, and it's about racism. It's regarding equity, inequity. The healthcare system is jacked up. Look at all the Black folks and brown folks that died during COVID. Now, is that such a coincidence? I said, I've been passing all kinds of legislation since I've been here, dealing with health disparities, diabetes, kidney prevention, education, cardiovascular disease, respiratory, asthma, you know, so forth and so on. And many of you all accuse me of trying to siphon off dollars from my community at their expense, you know? And so I said, well, look at how much money you all are spending in our community. It's a fraction of 1%. You all aren't putting any monies in our community to prevent these services or to provide treatment services. You know, we have all of these. We talked about task force earlier in this conversation. And I've sponsored so many and created so many advisory boards and task forces because I was looking for data. You know, I was looking for data. And so we get the data, and then next thing you know, it disappears. Nobody knows what the data states. You know, you're supposed to conduct research, you grab the data, and you make systemic changes through that data, but it just simply did not occur. So this time around, Rep. Lilly and I are literally at the table working with the governor's office and staff to implement House Bill 158, because in our heads, we know what the problems are and we want it implemented and we want outcomes differently than what has occurred in the past. You've heard Rep. Flowers talk about all the different pieces of legislation that she's implemented. This maternal health report is I mean, what are they going to do with the data? Are they going to put it on the shelf or put it in a file cabinet? No, 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 no. That's totally unacceptable. And we as legislators are going to have to step up to the plate and speak out more about it, especially when it comes to implementation. If it's not implemented the way we want it implemented, in my opinion, it's no good. It's just a waste of time and waste of money. Thank you very much.
Thank you so much. This next question I'd like to direct to Representative Lilly, and then anyone else can answer after that. We talk about a lot of resources in our communities that we need and that are there. And I would like to know from you all, what resources do we have in our communities to help ensure more positive outcomes for Black birth givers? And what's still needed? Where does Illinois need to get it right?
Thank you for the question. Great question. And I like to say there's opportunity. As mentioned by Reverend Leader Flowers and Leader Hunter, is that we have had for decades divestment that are going on in our community. Resources were pulled out. Less than 0.0000% of the state budget have been focused or allocated to communities, Black communities. So our resources are very, very slim. As Leader Flowers indicated, she has been talking, she has been begging the General Assembly and the administration to turn their methodologies around. What we are doing with, meaning the Legislative Black Caucus, we've came together with an omnibus of bills, which Leader Flowers' bills are at the top of it, where she has been challenged in the implementation and the lack of support. Now we have all of us working to support that type of legislation, making sure through our commissions, our task force, our meetings, our advocacy amongst groups like yourselves, where we are addressing the issues that are causing lack of resources in the Black community. We want to make sure that those groups are continuously at the table having the conversation to talk about I'm gonna give you the 5 groups that we're gonna bring the conversation forward and maintain it so we can get implementation. Health and Human Service Task Force. We want to make sure we are funding all of the resources needed to have better health outcome and pregnancy outcome for Black women. We have the Managed Care Oversight Commission, where we are ensuring that we do not like the managed care program because it has not been effective. Flowers have said this, in addition to the SMART bill, has led to lack of access to health care for poor people and Black people. And the managed care entity, unfortunately, has not been successful. We have a special commission on gynecology cancer research. We have a commission on anti-racism. We have a commission on Medicaid business opportunities to provide inclusion of all professionals, which does not exist in our communities, which does not exist in our industry. It is truly sad to be in 2021 and to be making these statements. And we have to put commissions in place just to bring people to the table like yourself with the leadership of Leader Flowers and Leader Hunter to get it done. But I'm excited to be in this space to make sure the fact that we don't have case managers, the fact that we don't have OB in our community, the fact that we don't have physicians who understand who we are when we deliver, the fact that we need funding for doulas, and we need doulas in our communities. If we want birthing centers, we need those as well. That is not funded. And so these conversations in this panel allow us to state what we're working on. And I just have to, again, thank Leader Flowers for holding up the mantle all these years. Today, we're working together. So thank you, Leader Flowers, doing what you've been doing on behalf of life, particularly. Thank you.
My pleasure.
Thank you so much. I'd like to let our attendees know that we're on the last few questions. So if anyone in the Zoom has something they'd like to ask our phenomenal legislators who have been leading the fight for proper solutions for this crisis, please put it in the chat now and I will address them. As a side note, we're going to go a couple minutes over tonight as we started a little late, but please ask questions in the chat and I will let the legislators know your questions.
I'd just like to add one thing. I have created this term, which in healthcare is something to talk about. I title it bottom line syndrome. And a lot of decisions that have been made in our healthcare settings is based on profit. And they have lost sight of the need or the right to healthcare. And they're making decisions if they cannot make a profit services. They're cutting OB, they're cutting midwifery, they're cutting, so that leaves it upon the state to the services are in these communities so that we'll have better outcomes. Bottom line syndrome in healthcare has caused many of us to lose our firstborns, our babies, and it has not and it has really been one of the major causes in our COVID crisis. So I just wanted, that's my term that I use, bottom line syndrome, which turned healthcare into a business, which automatically means people who don't have money will not get access. That's horrendous when you have healthcare as a right. Thank you.
That's a good point, Rep. Lilly. When we were going through and holding hearings for House Bill 158, everything that we pulled the cover off of was all profit generated. Every single item in that legislation, and we just simply had to tear apart the MCOs, the managed care companies, because those guys have made so much money off of the state of Illinois to the tune of they're getting about $9 billion with a B dollars a year to provide some kind of health care to the indigent and low income and other folks who need medical services, and there were so many gaps in services and so many people were just falling through the cracks because of no intervention, no follow-up, and it was just a crying shame. And we tore apart their contracts, and to the point where the state had to pull back and said, hey, what are you doing? And I even put some legislation, and initially I had this legislation, House Bill 158, to eliminate the managed care companies, because it seemed like Rep. Lilly and I weren't getting their attention enough. They were just totally ignoring us. They didn't think we were serious about healthcare for the Black folks, and especially maternal child health. So we had to get their attention. And once we had folks walking up to me saying, well, you're not going to really eliminate the MCOs, are you? I said, of course I am. What are you talking about? What are you talking about? We need to set up our own system, so we got their attention, we put it back in there. So now we're holding their feet to the fire. And sometimes, we need to take that kind of action in order to get these folks' attention, the state as well as the MCOs. So, yeah, that may have had something to do with the political piece, also the political question you had down there.
Thank you so much, Senator Hunter. We do have an audience question. Sierra is asking, she would like to know your thoughts about how telemedicine is or is not affecting access for underserved childbearing individuals, and if it's relevant for ongoing legislation guaranteeing access.
I'm sorry, what was the first part of the question?
Is telemedicine affecting access for underserved childbearing individuals?
Well, I just want to say in regards to telemedicine, telemedicine has its place, and some people could deal with telemedicine. But it was last year when we were debating telemedicine, I stood on the House floor and I told the story about how two women had died
Mm.
because they were seen by telemedicine. And they were trying to tell the doctor what their conditions was. And the doctor, again, was dismissive. And those women ended up being dead. So, once again, healthcare is not a one size fit all, and neither is telemedicine. Telemedicine is not for, if you have COVID, I guarantee you, no one has been referred to COVID to telemedicine. So the fact of the matter is, there should be a certain group of people that should not be referred to telemedicine in regards to pregnancy, because, especially African American women and other people of color, because of the high risk situation that we're in. And there needs to be a greater level of scrutiny in regards to what it is that how our healthcare is supposed to look and what is supposed to happen. My colleague just spoke about the MCOs. No one is holding those MCOs responsible for what they don't do. They have a conflict of interest. They have a fiduciary responsibility to their shareholders, not to the people that they're supposed to be checking on their well being. And so, as a result of that, they really can't have our best interests. I'm proud to say that in the late 80s and early 90s, in the 90s, we did get rid of HMOs
Right.
in this state, and they gradually came back. We had a patient's bill of rights. That's something else. When women go to the hospital and the way they're talked to and the way they're treated, doctors and nurses and other professions in the hospital, they seem to forget. We did not give up our constitutional rights when we crossed that threshold to an HMO, a PPO, or any kind of whatever. The
Mhm.
fact of the matter is that we need a healthcare system. And there's no way in the world that a profit driven entity like an insurance company, every time a patient present themselves to the doctor, they are costing that insurance company money. And the law says that they have a fiduciary responsibility to their shareholders, not to the patients. We need to understand that. That's the reason why I will continue to say that we do not have a healthcare system. We have an economic system, but we do not have a healthcare system. And by any means necessary, whatever it takes for them to make money, they'll do so. But to know, again, I will continue to use the word apartheid because that's exactly what we're living in. That's exactly what the outcomes of what's happening in these hospitals. And we need to do something about it. And we need some actual action, intelligent uh, information. We need some intelligent information that to come out of this report that the Department of Public Health had in order to put us on the right path to show us what they're going to do to make this state. We can't do nothing about the country, but we sure can do our part. And it shouldn't be, again, based on our zip codes. Thank you.
Thank you, Representative Flowers. We have a couple more questions tonight. Considering that the primary has been moved back a few months, is there anything people can do to aid your crucial work during the shortened legislative timeline? Is there any piece of legislation that you'd like to see passed in Illinois to help Black maternal health? Are there any bills that will be brought up during a veto session that you would like us to support?
Well, I don't mind supporting. I'll continue to support Black maternal health pieces of legislation, but we also need to hear from you all. You all need to work with us and tell us what you think are the gaps in services and what you think that we need to work on. That would help, because see, what we see could possibly be something entirely different from what you guys see or what you would like to see us working on. And so let's form this partnership, and see what we can do to help one another, because, I tell people all the time that we do not have all of the answers, nor do we have all of the solutions. We see you guys are as our eyes and ears of the community. Okay. And so, because see, most of the time we find ourselves stuck in hearings and meetings all the time and driving back and forth to Springfield, but you all are on the ground. So talk to us, work with us, and help us address some other issues and some more issues out here in the community. That's what we need.
Only thing that I would add to that, as we look at legislation that has been passed and signed by the governor, and we have not appropriated or even implemented it.
Yeah.
That's going to make the difference.
Right.
We need to make sure we hold the administration accountable for the work that collectively we've come up with. Yes, we need to work alongside them, because we see, as Leader Flowers said, decade after decade, is just not, it hasn't been done. I just don't get that. So we have to do something different. And I think, I'm going to say, holding their hands to get it done is going to make the difference. And I too agree that we need you to be right there with us in the different commissions, the different meetings, the different ideas. We are here. And I think I'm just going to use Leader Flowers. She's been here.
Yeah.
Okay?
Yeah.
So just waiting to get to this point, and making sure that we are addressing what needs to be addressed. So I'm happy to be on the panel and just be a part of the solution. I'm excited about that. God is good, even in the midst of all of these inefficiencies. He is good. Thank you.
I want to say we need more.
Mm-hmm.
We need more of everything. We need more doctors, not just doctors. We need more Black doctors. We need more Black nurses. We need a better environment. We need better access to housing. And all of this has a lot to do with healthcare. We need better jobs, better quality of life. And so until such time that we need more midwives, more doulas, we need people that's going to be culturally responsible, with evidence-based, and be patient-centered. We need more attention. We need more attention. We do not need to be dismissed.
Right.
And so when you look around and you look around at the hospitals and you see things, if you see something, you really have to say something. Because, and then when you think about at a time when a pregnant woman is in labor or going through changes, or even if you're sick, that's the reason why so many of us died during COVID. COVID didn't kill. It was the underlying condition that killed. And if you cannot see a doctor, if you cannot see your healthcare provider, if no one wants to listen to you or believe you, then what? Then I ask the question, where's your insult level? Where's your insult level? Black women have been carrying the weight of the world on our backs since the beginning of time. And enough is enough. It's time for us, and I make no apologies. I want more. I want more, better quality outcomes for our children. I want better schools. I want cleaner water. I want safer communities. I want more. And I make no apologies. And if that means that I have to take from you, because when you think about the systematic and the systemic racism, that's exactly what's been happening. Stuff has been taken from us. Now, I don't want to take from nobody, but I want my fair share for my community.
Mhm.
Thank you.
Thank you so much, Representative Flowers. There's no shame. We definitely do deserve more. For our
Yep.
final question, I think you've all addressed a bit of this, but in case you have anything to add to conclude our event, how can individuals get involved in influencing legislation that will help Black women and birth givers?
Well, they need to follow your lead. You need to educate yourself on the issues, educate yourself what's going on, become volunteers in the hospital, become a doula, you know, work with a midwife, be a home health care worker to find out what's going on, what needs to be done. You have to be in the trenches in order to know what you need to know. You can't be from the outside guessing. I'm very fortunate that I've been around for a long time and I've been able to see some things. I remember when we had 10 or 15 more hospitals in my community than what we have now. We live in a healthcare desert. Just to give an example, when I introduced a bill last year about having more hospitals all over, not hospitals, birthing centers for women and children all over the state. Some of my colleagues voted it down. And how I got the birthing centers this year was because I had to, I work with some of my colleagues on the, I work with some of my colleagues and got the birthing centers, but that's still not enough. But the fact of the matter is, we have to have more. And this big I and little u is going to have to be put aside. And just to be quite honest with you and to say it plainly and plainly and clearly, that white women have been the benefactor of a lot.
Yeah.
But in spite of that, they are dying at a higher rate as well. But we haven't even touched on mental health. We
Right.
haven't touched on mental health parity. We haven't touched on high blood pressure and uh, all the other preeclampsia, the things that are preventable. It's preventable. Do you know that I found out from visiting the hospital that there's a certain type of blood pressure cup that a woman is supposed to use when she's pregnant? But it was a one size fit all. So it's all about education. It's all about exposure. So we have to educate ourselves. We have to get involved and we have to stay involved. And it's a lot of hard work and long hours, but we're going to either live with it or die from it.
Yeah, I think it's important that, and I agree with everything that Leader Flowers has just stated. But I also would like to add that it's very important that since you all are a very strong advocacy organization, it's important that you learn the legislative process. You know, learn how to lobby us and advocate what your needs are. You know, and if you all don't know, then we'll teach you how to do it, because there aren't that many people that really know the legislative process, especially the grassroots community-based people. You know, they come down on buses and they know some things, but we need to teach you how to do how to understand the entire legislative process, from the time a bill not only passed, but how do you develop and how do you put together legislation, you know, just the entire process from beginning to end, from the time you start, create legislation to the time where at the final end where the governor signs it into law. And I believe that once we become more politically astute, we would advance more as a people. You know, you need to learn how your tax dollars are spent. You know, there's a lot that folks need to learn, and because I mean, there's a lot to learn, period. So I can just go on and on and on about that. So thank you very much.
I will just add, I too agree with Leader Flowers and Hunter on getting involved. But also establish your own list or directory of people who want to volunteer, experts. Have those names and that information available. So when we're asking for help or we're asking for people to get involved, those lists are already set up and ready to go.
Go.
We often, I can't stand when we say this. I couldn't find any Black people. Can't stand it. And that is being said over again.
Right.
It just amazes me that that statement keeps being said. So just keep maintaining your list, and make sure people are energized and synergized. And I know most people don't think this is true, but you know, that positive energy, it keeps you getting up and coming back because it is a lot of work. See this as a opportunity, as glass half full, because we have to as Leader Flowers said, we need more. So we want to overflow this glass. So we have to see this glass half full and make sure we're working together. And that's the piece, working together. This divisiveness that is existing amongst our community, it has to stop. We legislators have learned to figure it out and work together. And we stand on the shoulders of people like Leader Flowers, but we all are needed in this space to get this done. And whether we women or young women, old women, older women, we got to work together. So that's all I would add to the work that's in front of us.
Thank you.
Yeah, we need you all to come down and testify on bills. Y'all the experts. You all know more than us. I know you do. You know, so just go online and you can find out what we're working on, the projects we're working on. And if going online doesn't tell you enough, then pick up the phone and call our offices and just ask them, what y'all working on? What is it that that we can help you all with? You know, we may need you all to go out and find some proponents of some legislation. We may even need y'all to help us kill somebody's legislation that is harmful to our community. You see? So because there's, I mean, we can't do everything. So we need armies like you all. We need concerned individuals such as yourselves to help us get this job done and improve the quality of life of all of our families. Thank you.
Thank you so much, Senator Hunter. What a phenomenal panel. I could sit here all night, listen to y'all speak, and I know people in the comments can think that too, but unfortunately we reached the end of our event. And we hope that you've gotten a solid overview of the massive amounts of work our legislators have been doing on this issue for decades. Now with the task force and public attention, this issue is finally on the radar screen for more people, and we want to help build on that momentum. If House Bill 3401 is up in the next couple of weeks, we'll keep you updated on our social media, and please definitely fill out a witness slip when we ask you to. Check out the rest of our Black maternal health series in the days to come on social media. We're going to be highlighting several organizations in the state doing critical work to help improve maternal outcomes, and there's several ways we'll be asking for you to help. That's all for tonight. Thank you to Representative Flowers, Representative Lilly, and Senator Hunter for your time and your work to move our state forward. Thank you all for joining She Votes Illinois, and have a great night.
Thank you, guys. Keep up the good work.
Thank you.
We need you. Good night.
Good night.